So I chose to do my presentation on the von Willebrand disease. And this disease is the most common genetic blood clotting disorder in the world. According to the CDC, as of 2019, it affects 1% of the US population, and which means it's about 1 in every 100 people get it. This disease is caused by a defective clotting protein called the von Willebrand factor. And this factor is meant to bind with factor VIII, which is another vital clotting protein. Together, they serve as a glue or a plug, holding together several clotting factors during the blood clotting cascade. And it's necessary because in order for that to happen, it needs prothrombin to be converted to thrombin. And when that doesn't happen, it causes frequent and excessive bleeding. And it varies based on the severity of what type of von Willebrand disease you have. So the von Willebrand factor also helps platelets bind to injured blood vessels. Therefore, when you have a malfunction, you're more prone to bleeding. It is considered an autosomal dominant trait, and it appears on chromosome 12, and it affects women and men equally. So the disease is important to understand for healthcare workers, because if someone has this disorder and they're at more risk of bleeding and they're undergoing surgery or having childbirth or they're having uncontrolled bleeding, then it's good that we know about this disease so that we can take the adequate precautions in order to save them or help them not bleed and make complications worse. It is also important that we know, because it is the most common, we need to be educated about it, so that we can diagnose it early and get the patient's proper treatment when needed. So the von Willebrand disease is detrimental to the health of the human. So there's 3 different types. The first type is the most common. About 60 to 80% of patients have them, and they have mild to moderate symptoms. And they'll have symptoms such as unexplained nosebleeds or skin lacerations that will bleed for usually longer than 30 minutes. They'll usually have bleeding from any type of dental work or any mouth sores or trauma in the mouth. They'll also have unexplained bruises that are usually caused by little or no trauma. And then women will have a heavy menstrual bleeding that can also lead to anemia. Type 2 happens in about 15 to 30%. And instead of type 1 having the low factor, in type 2 you actually have the normal level factor, it's just not functioning correctly. So these patients also have mild to moderate symptoms, just like in type 1. Type 3 is the most severe. It happens in about 5 to 10% of patients, and they'll have spontaneous bleeding episodes, usually in the joints, muscles, and organs, and this can be life-threatening. The disease is usually not diagnosed until adulthood because symptoms are sometimes not taken seriously, or if it runs in the family, they usually just do what works for them instead of getting help. The most common treatment for type 1 and type 2 is called desmopressin acetate, and it's given by injection or nasal spray. And this imitates the hormone of vasopressin, which stimulates the release of the von Willebrand factor from the cells, increasing that and the factor VIII, so it's helping that clotting. And for those that are severe enough, they can receive factor replacement therapy through IV, and there's also antifibrinolytics that may also be given to slow down the breakdown of clots, blood